we're trying to create a movement that can embrace the technology, and so that together we can create how we want to use it and make sure that low and middle income countries around the
Hmm.
world also benefit from the technology.
How do we decide what is the number one health issue, considering there are so many different economies, so many different cultures, and so many different backgrounds that people are coming from?
What governments have to decide today is, what is the future do they want? Do they want a future of development and progress and prosperity, where health is a natural outcome? Or are we going to continue to focus on models that lead to more inequity, to more
Hmm.
poverty, but most importantly, to make sure that the digital transition leads to health system reform, that we actually transform our health systems to be more and more focused on achieving more value, which means better health outcomes for citizens, not being part of a purpose or a mission driven kind of life would be something that doesn't make sense to me.
Hello, and welcome to a brand new episode of YO.DH Dialogue, a podcast where we deep dive into conversations about digital health along with experts from the field. Well, Youth Dialogue is an initiative of Youth, which basically stands for Youth Ownership of Digital Health, and is a community of young digital health professionals. I'm Kopal Khanna. I'll be your host for this particular episode. Well, our guest today, how do I introduce him? Because there are so many impactful, beautiful hats that he dons. But one thing that I can say is that he's truly on a mission to make the world a healthier and a better place. Whether he's driving AI initiatives in health or advocating for change, he is unstoppable. As the CEO of HealthAI and founder of Unite Parliamentarian Network of Global Health, he's at the forefront of change. And today I'm just so excited that I get to chat with him and hear his story. Dr. Ricardo Baptist Late. Welcome to the podcast.
Thank you, Gopal. It's a real pleasure to be here, and congratulations on such a great initiative.
Thank you. Thank you so much. Thank you so much for taking out the time from a very busy schedule to chat with us. Um, Ricardo, I know that we're short on time and I want to dive right in. And something that ever since I have started, doing research and learning more about yourself, very first thing that kind of pops in my mind is, given your backdrop in health, politics, and technology, um, the first thought that comes to mind is the current geopolitical situation across the globe, right? The word unite probably holds tremendous value in the current day and age. And Since you are somebody who's at the forefront of leading healthcare initiatives, and you're constantly working towards creating a united health ecosystem, in fact talking a lot about universal health coverage, given the current political situation across the country, how does that impact your policy making or advocacy? Does that impact the health initiatives given the current situation across the globe?
So
It's a
we're
loaded
starting,
first question, yes.
we're starting with the easy questions.
Yes.
Yes, and the easy answer is yes, of course. Um, as you mentioned, my background is somewhat diverse, having worked as a practicing physician for many years, and then shifted into politics. And having been 4 terms in parliament, I was also in local government, and more recently leading HealthAI, the global agency for responsible AI in health, where we're actually working with governments around the world towards building regulatory capacity so that countries can validate AI tools, ensuring they are safe, effective, and have the quality needed to ensure that they lead to better health outcomes for all. These missions, along with the Unite Parliamentarians network that you mentioned, which is a network of policymakers that I founded in 2017 and today is present in more than 110 countries, we end up seeing that all of these efforts nobody is really alone. Nobody is an
Yeah.
island. No country
Yeah.
is isolated from others. And so, what does seem sometimes to be very far away from a geopolitical perspective, when you go to the US or you go to Latin America or you go to Southeast Asia and you talk about the invasion of the Russian forces in Ukraine, it seems like a very distant reality. But if we look over the last 3 years, we see how this has had a tremendous impact across the globe, how it has shifted different positioning of governments, of how that has led to different decisions on partnerships and investments, and how we're seeing all countries around the world putting more money in defense, which means less money in other areas, particularly
Yeah.
health. And so, and we also see, sadly, I would say, less and less openness to cooperation at a global level. And so, absolutely, that all of these different conflicts, wars, geopolitical phenomena, they all have consequences. When it comes to health, they all have impact in health. They are determinants of health, if you will, and that typically leads to less optimal health outcomes in a time when we should all be working towards the sustainable development goals, towards ensuring universal health coverage. But just to give you an example for the young listeners out there that are not aware of the sustainable development goals, these were goals that all countries agreed upon in 2015 that we want to achieve by 2030, be it in health, climate change, and so forth. Well, we're halfway there. 2000, we're in 2024, and we've only achieved 15% of those goals. And which means 50% of the time has passed, and we've only achieved 15% of the goals. We still have a long way to go. And the fact that we're delayed, of course, the pandemic didn't help, and all of these different challenges, but also these geopolitical conundrums are really raising the barriers to achieving them. So we hope that the youth listening to this podcast can also call on their governments to keep them accountable and responsible. We need responsible leaders to ensure better health for all.
That is so true, Ricardo. In fact, I would definitely want to deep dive further into the sustainability goals. But before that, you mentioned something really important. You said that sitting in our homes, what is happening in other parts of the world sometimes does seem like a distant reality. Like me sitting in Delhi, there's a war happening somewhere right now, and to me as an individual, perhaps it does not affect me on a day-to-day basis, but it is having major repercussions, across the globe. And I was reading up about you, and you weren't that away from war when it was happening in the Ukraine. You actually went there to supply medical aid. I cannot imagine what that experience would be like, and I would love it if you could share that with us. What was that experience like? What made you go there? I know that you're a practicing doctor, sorry, that you are a trained doctor yourself, and that was perhaps one of the reasons. But just at a personal level, professional level, what made you go there, and what was that experience like? If you could tell us about it.
Well, since I got more involved in politics, of course, my activity as a practicing physician went down.
Yeah. Yes.
But there were moments that I felt compelled as a volunteer to use my profession to support the communities where I lived, which happened during most of the pandemic of COVID-19, where I decided while at the time I was in Parliament as a member of Parliament. On weekends I would work in the hospital in my hometown, and I did that for about a year and a half. And then when the Russian forces invaded Ukraine, it became very clear that there was going to be a need to provide support when it comes to the health impact of the war. Sadly, we know that conflict leads to terrible consequences. We always think about health and conflicts and wars. We think about people in the front line, the effects of bombs and shots and wounded people. Of course, those are terrible consequences of war, but there is another level of consequence that is not as visible, which is the fact that people that live in those countries that are in a conflict, they continue to have health problems. Women continue to have babies, diabetics patients continue to need their insulin, and so forth. And everything tends to collapse in terms of the response to these patients, to these people. Those that are most affected, as always, as in any crisis, are typically those that are most vulnerable: the children, young girls and women, and the elderly population. And as I said, so I'm the president of the Unite Parliamentarians Network. We actually launched an initiative of sending out recommendations of what we felt from a policy perspective should be done in terms of responding to this conflict. But then it also became very clear in those early few months of conversations that there was need for support on the ground. And I was in Parliament, so in the summer we have normally a recess, and so, speaking with the Ukrainian ambassador in Portugal, I offered myself to go as a volunteer, as a medical volunteer, during that recess to work in Ukraine. And I ended up doing that, precisely working as a volunteer doctor at the Lviv Regional Hospital. And it was quite an experience, I can tell you. Just the fact of getting there by train in a wartime, because as you know, there are no flights. And then in Lviv, being welcomed by the people who are, the train station being Lviv, one of the most western part of Ukraine. It's where a lot of people are running away to from the front line, close to the
Yeah.
Russian border. And so that you would see uh, at the time hundreds of people just arriving as refugees within their own country, and a lot of volunteers welcoming those people. And then, you know, working at the hospital during the day, several times a day, you would get these alarms going off warning that air missiles were being launched, and you'd have to go down underground to bunkers taking patients with you, and the same would happen during the night. And one of the things that shocked me the most was part of my volunteer work. They put me stationed in an intensive care unit for newborn babies. And this had been built underground because when the alarms go off, these babies are in incubators. You can't pick up an incubator and go downstairs. So the people have been working there now for 2 years plus,
Mm-hmm.
underground in bunkers with these babies and incubators. And to see them working in those conditions with no natural light underground, I mean, I can tell you, I was working there for an hour and my t-shirt was already glued to my body with the sweat, right?
Imagine.
With the heat.
Yeah.
So you can see what it is for these people from a psychological perspective, living in a war zone, being in a country with conflict. And what is quite interesting in a dramatic way is the fact that many of the women that are pregnant, they have less prenatal care, which means that a lot more babies are born with either health problems or they're born early. And so I remember very clearly a very small, tiny newborn. Her name was Milana. She was 700 grams weight when she was born. Her brother, they were twins. Her brother passed away on birth. She survived, but with a very severe septic infection, and she was under antibiotics. 700 grams. The expectations were very low. A terrible prognosis, and her mom was there every day, of course. And throughout the time she was doing the antibiotics. Then I was stationed in other places. On my last day before leaving, I decided to go check on how she had evolved. And when I got there, the Milana was already over a kilo, still doing antibiotics, but already outside of the incubator, already lying down on
Oh,
her mother's chest. And every 6 months, her mother sends me a picture of her growing up.
oh, that's so nice.
Yeah, and so I guess that those are small signs of hope in
Yeah.
in, in the midst of tragedy, and I truly believe that babies and children like Milana are going to grow up, I hope, to live in a free country and to fight for the ideals of freedom and democracy.
I really hope so too, Ricardo. I mean, when you were just talking about it, I was getting goosebumps just imagining. And I mean, I honestly can't even imagine. And clearly, you left a tremendous impact over there while you were there with Milana's mother sending you pictures every 6 months. Um, but uh, what sort of an impact does it leave on you as an individual after you're back to your own country? Um, does it affect your decision making on a day-to-day basis? Does it affect your perspective? Can you tell me a little bit more about that from a personal, point of view as well? What sort of impact does it have on you as Ricardo?
Yeah, it was tremendously impactful
Yeah,
for many reasons. It was the first time I was in a country in conflict.
yeah,
During that time, I did go to the capital, to Kiev, and I had an opportunity as the president of Unite to meet with the Minister of Health, Victor Liasco, who's doing an amazing job of running a health system in a time of war. Um, and I remember asking him what was the thing he needed the most in terms of help. And he
yeah,
says, I don't have enough prothesic limbs for the people in the front of the war that are losing their legs and arms and so forth. So you can understand how dramatic that is. And then I also visited two cities near Kiev called Busha and Irpin, that were one of some of the firstly invaded cities at the beginning of the war, when the Russian forces they stepped into these cities. We're talking about higher middle high class cities. um, if you're from New Delhi, you can imagine the diplomatic quarter, right? It's that level of a city. And 10% of the population was killed and slaughtered. And you can see the buildings completely destroyed. This inevitably leaves an impact. But the most impactful day was the day I left, when I got a ride by car leaving, by a priest who had helped me a lot while I was there. And a huge line to get out of the country. We finally got to the border with Poland, and as soon as we crossed the border, I have a European passport, so it
yeah,
was easy to get out.
yeah,
And as soon as we crossed the border, and I see the European flag, and I see these prairies on both
mm,
sides of the highway, and to understand that a simple physical man-made border separates a country in war from this sense of freedom
yeah,
was one of the most impactful sentiments I've had in my life. And it really goes to show that we're so lucky if we are able to grow up in a place that we feel we don't even understand what not
yeah,
having freedom is, where we have access to everything we need, including healthcare, of course,
yeah,
uh, but that basically our families can grow up with a sense of freedom and being able to dream about the future. And so that I've tried to stay connected and supportive as much as I can to the people of Ukraine, precisely because that is an experience that really shapes you and changes you. And it goes to show that um, these kind of conflicts really have a tremendous negative impact on health in
yeah,
general. And of course, I mentioned health from a physical perspective, but the mental health
yeah,
consequences
of
are
course.
brutal. I
Mm,
mean, I remember I was just there for a few weeks, and just being there, waking up, every night, 2 to 3 times a night, because of the alarms of air missile attacks, where you
yeah,
have to move. Imagine doing that for years, right? Where you
mm,
can't have a good night's sleep, where you don't know if the next air missile is going to hit your home or of someone you love. And that's
yeah,
the kind of place that these people are living. And so, yeah, it before I used to speak about conflicts in theory. Now
yeah.
I understand a bit more, and it makes me much more humble to understand how challenging it is to address these tremendous threats on our existence.
Oh, Ricardo, like apart from all the other things that I am feeling, I think one top feeling right now is just gratitude for everything that you are doing. I'm just so grateful people like you exist who are making that impact, and amidst everything that's happening, driving that change. So thank you so much for doing that. Just wanted to say that came straight from the heart.
Mhm.
Um, let's go way back, Ricardo. That little boy in Portugal. Where did the seeds of working in, of course, doing some tremendous work in health and advocacy and technology. Where were those seeds sown back in Portugal?
Well, well, first of all, let me just take a step back to say that all of the things that we've been talking about, I was just a very small part of them. There were amazing teams behind all of those efforts,
Mm,
and there are amazing people out there doing tremendous jobs, and you can see that across the globe. And it's just an honor to be part of such a global effort. And I really call on anyone who feels that urge to be part of a better world to really step up, and there are many ways to collaborate. Um, well, going back to my boyish times, I actually was
yeah.
born. I was born and raised in Canada, and so the history is very simplistically. My parents were from Angola, which was a former Portuguese colony. Three
Mm,
generations before them were born there from my father's
mm,
side.
mm,
But in 1975, they had to leave the country as refugees,
mm,
and they left to Canada to start a new life. That's why I was born there, and I grew up there until I was about 11. And during those years, those were very formative years, I would say, in the sense that the Canadian education system had a tremendous impact on me. First of all, it really inspires volunteer work and community-based initiative, I would say. And so that has been sewed into me, as you using your words,
yeah.
from very early age. Not being part of a purpose or a mission driven kind of life would be something that doesn't make sense to me. And I think that contributed a lot. Of course, my upbringing with my parents, who always instilled with me a sense of public duty, of course, also played a very important role. But also that community factor was critical. The other thing was, at about the age of 8 or 9 years old, I remember visiting the provincial parliament of Ontario in Canada. And that was the first time I really saw politicians in action. And I found it quite impressive to see how basically society would choose a group of people through elections to represent their interests. And that concept as a child was mind blowing to me. And so that was kind of really the first time I saw, oh, this is something interesting. And I remember that these children, well, teenagers, were serving water to the parliamentarians, and they told us that these were the best students in the province that were invited to do internships there. And so it became my life goal to become a water boy at the provincial parliament, because I found that so. Then at the age, almost, yeah, between 11 and 12, my parents decided to move to Portugal so we would be closer to my extended family. And that's where I grew up, learning the language. For that was quite challenging, but then getting more involved and student. I was elected as president of the student body in high school, then med school, and I was always between medicine and science, which is a true passion of mine, but also with public engagements and politics. And so halfway through med school, I started getting involved in local politics through the Social Democratic Party. And then that's how I basically started getting involved, balancing my work as a physician with my political activities. And in 2011, after a few years as working as a practicing physician, the opportunity came up to run for parliament, and that's when I shifted to become a member of parliament for the first time, and then I ended up doing 4 terms, and was also a deputy mayor in my hometown.
Wow, what a stunning journey that is. Um, Ricardo, I mean, very few people get this opportunity to kind of balance both politics and health, and that gives you room to create so much more impact because you can, there is that room for advocacy as well as using health and technology, etc. Right? Could you shed some more light on just how your role at Health AI and also your role at Unite kind of just aid each other or are connected.
Right. So, well, starting with Unite, Unite came up as an idea back in 2017. It was actually starting to brew even before that,
Mm,
uh, while in Parliament, because it was very clear to me that parliamentarians were not speaking enough among each other from different countries on global health matters. Many
mhm,
times I was in global health conferences, and very few parliamentarians were present. And in reality, parliamentarians are the ones that actually approve budgets.
yeah.
They change laws, they can change policies, they keep governments accountable, and they're directly connected to the people. And so, as representatives. And so, um, I felt that we weren't maximizing the potential there.
Mm,
And so creating a network of parliamentarians was an idea that I think had tremendous potential, and that's how we launched Unite initially as a infectious diseases network, and it evolved to become the Unite Parliamentarians Network for Global Health, which very much accelerated with the COVID pandemic, and
yeah.
where the world really understood the need to work together. And
Mhm,
that's how we reached this point of being present in more than 110 countries. And within that work, we're doing amazing work also in the field of digital health policy. We have a digital health policy desk, actually led by a colleague of ours based in India, Ashia,
ah, nice.
it's really trying to push the topic of not only ensuring that there are policies in place to
Mm,
foster the adoption of digital within the health space, but most importantly, to make sure that the digital transition leads to health system reform, that we actually transform our health systems to be more and more focused on achieving more value, which means better
mhm,
health outcomes for citizens. And, and artificial intelligence is now in the rise, coming from a research topic really towards mass commercialization. I foresee that all digital tools in the future will end up having some form of deep learning, machine learning, AI incorporated. And this will be an opportunity to transform health systems once again, and potentially to actually lead us to shift away from this kind of reactive system that we have today. Most
mhm.
health systems are focused on disease. We need
Yeah.
health systems to be focused on health. And so AI, I believe, has that potential. I've always been very much connected to digital. My father is from computational science field. So
Mm,
as a young child, I remember my dad working from home using a modem in the 1980s, which was
yeah.
not something very home working today seems like a very basic thing. It wasn't this case in 30 or 40 years ago. But even as a medical doctor, I worked many years as a consultant in the field of
Mm,
digital. And in my academic work, I've worked a lot in that frontier between health policy, and digital. And so, as I grew up personally and professionally, this has always been a core aspect. And my belief that technology, if used wisely,
yeah.
can have that transforming capacity. And so when the opportunity came to be
Mm,
able to lead the global agency for responsible AI in health, HealthAI, a
yeah.
nonprofit based in Geneva, I believed that, after 12 years in active politics, I felt the time was right to step down from parliament and to take
Mm,
on this new challenge, particularly because AI has such tremendous power to
mm,
be transformative. That transformational power can be used for good or for bad, and to
mm,
be able to make sure that we achieve the health outcomes we want, to have that tremendous impact in health systems that lead to healthier societies at large, we need
mm,
to make sure that we create an ecosystem in which the technology, first of all, is accelerated in terms of investments, in terms of access, in terms of adoption, but we also need to build trust towards that technology so people adopt it. And so we
yeah.
need to create a regulatory ecosystem that ensures safe, quality, effective tools are put into the market. And so that's what we're doing, working with governments around the
Mm,
world through
mm,
with Health AI. And we just launched a community of practice that any
mm,
institution around the world that would like to be part of it can apply on our website. And we are trying to bring the world together to co-create what the future will look like with AI. In the past, technologies have come into health and then we've all had to adapt to the technology. What we're trying
mm,
to do here is turn the world around, if you will. We're trying to create a movement that can embrace the technology, and so that together we can create how we want to use it and make sure that low and middle income countries around the
mm.
world also benefit from the technology, and so that we can use the technology as a great equalizer instead
Mm.
of seeing what we're seeing today, which is a widening of the digital divide.
I have so many questions. Okay. You mentioned global agency. So, whenever we use the word universal or global, we're using it as like one unit. Um, but I mean, the different economies, different cultures. Like I mean, here in India itself, where I'm from, which is Uttar Pradesh, there's so many small villages, small towns, where the access is super low. Even probably the data that we have, perhaps you don't even have data from those little villages. Ricardo, I have I think two questions. One is, what is the number one pressing issue when it comes to digital health currently? Um, and just leading from that, um, how do we decide what is the number one health issue, considering there are so many different economies, so many different cultures, and so many different backgrounds that people are coming from? How is that decision made?
Hmm.
Is-
Yeah, those are, yeah. Well,
yeah.
I would say the biggest challenge for me when it comes to
Hmm,
digital
hmm,
in the field of health is, what are we talking about? Clarifying what we're talking about and what we want to achieve. I'm saying this because most governments around the world that are saying they're investing a lot in digital, what they're doing is basically translating their current analogical processes that they're doing on paper into digital format. That doesn't actually change much. Actually, it gives more work to doctors and nurses and to health workers without much benefit.
hmm,
That's not a digital transformation. That's basically a digital transition that actually pushes people away because people feel there's no benefit and it's a waste of money in reality. So, to discuss digital health seriously, we need to understand where we want to go first. And that's where the power of leadership is so important. Our prime ministers, presidents, ministers of health, people leading our health systems around the world need to be crystal clear where they want to go. And if we want to transform a disease driven reactive model to becoming one focused on health and well being, well, then let's use digital to provoke that transition. Let's use digital to leapfrog the system into the future. Let's use digital to overcome the major challenge of lack of human resources so that we can provide care to everyone. And let's design the way we deploy the technologies to make sure it's inclusive, it's fair, making sure that it's it's accessible to everyone on the principle of universal health coverage, which means that even those populations that are most marginalized, that are most vulnerable, that we design from inception how this technology will reach those people and benefit those people. Today, I don't see that happening in many places. And so that I would say is critical for the success of digital actually to have the impact that many believe is there, or at least the potential is there. Beyond that, I would say that artificial intelligence in particular has a great accelerating factor in terms of making sure that the promise of digital can lead to better health outcomes, but it also has to be designed right. And many institutions have come up with the principles we call responsible AI that need to be applied here. But most importantly, as you mentioned, and I appreciate that, is that, oh, and even for us as a global agency, we know that especially when it comes to AI, you can't have one big agency telling the world what to use or what not to use. Especially with AI, that depends so much on local data to make sure that it's not biased, to make sure it is adapted to the local reality. What we are doing is working with countries to co create the local regulatory capacity because there has to be local leadership. And so, one of the challenges is precisely how do you build that capacity locally?
yeah,
Because in many countries, it's just, or many regions, it's just not
yeah,
there. And
yeah.
so, those are some of the biggest challenges, I would say. If we get that right, potentially we can see the acceleration of not only investments but also adoption of AI tools for health, and that could actually lead to a society where the population is not only living longer but actually living healthier, with where quality of life becomes a core element of the kind of system that we're promoting. And we know that societies that are healthier tend to be more developed, more tend to be more prosperous, and uh, and we know, on contrary, that poverty is the main driver of disease. And so,
Yeah.
what governments have to decide today is, what is the future do they want? Do they want a future of development and progress and prosperity, where health is a natural outcome? Or are we going to continue to focus on models that lead to more inequity, to more
Yeah.
poverty? And even though you have a 1 or 2% that are extremely rich, the general population will just get sicker and sicker, and not even the money from the richest will be enough to fill the void. And I
Yeah.
don't believe that's the kind of model of society that we want. And actually, it's a
Yeah.
model that we have seen can fail.
That is absolutely true. And I really want to also dive quickly into the AI aspect and the technology aspect. But right before that, you had mentioned universal health coverage. Ricardo, for our audiences, could you just quickly break down what universal health coverage is? And also, another question that I have in mind is, I mean, universal health coverage is the need of the hour, but like you had also mentioned that, right, we're working towards it, but we are far from it. So it like, I mean, it might be a harsh word to use right now, but does it seem like a little bit of a utopian concept? And if yes, other than governance, which you've just spoken about, what is like that other number one factor, other than perhaps governance, that would help us really run towards that goal of universal health coverage?
Well, trying to break it down simplistically, universal health coverage is ensuring that everyone, everywhere, gets access to the healthcare they need,
Yeah.
in terms when they get sick, but also to the prevention services that they need, so they avoid getting sick, so that we can prevent preventable diseases. So that's kind of the kind of broad optimal solution that UHC should promote, which of course is very much based on the investment on primary healthcare, so through family doctors, so making sure everybody gets access to the most basic form of care within their communities, be it in a village or in a city, or in a mid-sized town. That being said, um, what we're seeing, what we're seeing in many parts of the world is, sadly, many parts of the population are still excluded from that. So there are still importantly marginalized or vulnerable people. Mind you, I come from infectious diseases as a physician, so I
Yes.
worked a lot in the field of HIV and AIDS. And sadly, we've seen in that field how marginalized populations tend to get sicker and sicker, and that's something that we need to fix by design. And that when we say about universal health coverage, we have to be serious about the word universal, which means not leaving anyone behind. That takes a lot of investment. But also, we know that the lack of healthcare workers is a major challenge for many countries, even high income countries. And that's where the role of technology can play a very important role. So, I was explaining before, if we use technology, if we use AI and digital tools to make sure that we're ensuring access to care to those that don't have access, as either complementing the work that is being done by humans, or in some parts of the world, in a way, providing some form of care in the absence of
Yeah.
any other. These are tremendous opportunities that we should embrace, because right now there is an important part of the population that continues to have zero access to healthcare, either due to financial barriers or due to their geographic distance from any form of care. And even with digital tools, there was an interesting study that came out a couple of years ago that showed that and this was in sub-Saharan Africa, the further away people lived from a hospital or clinic, the higher the probability they didn't even have a phone. And so it's kind of like
Yeah.
people live in a situation where they have multiple layers adding on top of each other of inequality. So they're far away from a hospital, they're far away from a city center, they don't have digital connection, they don't have access to the internet, they don't even have a phone. And so these people, of course, are much more vulnerable. Hopefully, if the world is able to continuously promote universal health coverage, even those people will stand a chance at getting access to the care that we believe everyone deserves.
Yeah. And of course, I mean, the issue is so much more nuanced and complicated than we can perhaps imagine, but it's obviously very, very important to speak about it and to do something about it. And thank God for AI and all the
Mhm.
efforts that are going into using that technology for these healthcare initiatives. Of course, we're using AI, and there is a I mean, so to say, a revolution that's being created in the world of technology and health as well. But Ricardo, you mentioned something really important when you were talking about AI earlier, and you mentioned responsible AI. Um, can you shed some more light on what responsible AI means and how important is that?
Yeah, absolutely. Just to say, on picking up on what you were saying on universal health coverage, also, is that it's very important, especially for low and middle income countries, that we don't import to or export from high income countries broken models to low and middle
Mm,
income countries. And we're seeing that a lot. So countries that have very low resources, they're investing the very few resources they have in building hospitals, for example, where maybe with the same money, they could build smaller
mm,
clinics and invest in much more technology that would have much more impact. But from a political perspective, sometimes it's easier for a politician to open a new hospital and be on the front
yeah.
page of a
Mm,
newspaper. I get
mm,
that, but we need to be focused on results, and
mm,
results meaning better health for citizens and less on shiny objects, I would say.
yeah.
And that takes us to AI and responsible AI.
Mm,
AI has the potential of being the greatest equalizer, as I mentioned, but it also
yeah.
has the potential of being the greatest divider. If it's deployed unevenly, if it is not shared to the communities at large, including low and middle income countries, if the principles of responsible AI are not respected, this may actually lead to part of the world moving faster to the future, while
Yeah.
many others are being left behind. And what are those principles? Well, there are many. And actually, these definitions vary a bit, but I can share some of the key elements of responsible AI that I personally take into account as personally as the most relevant ones. One is transparency. Knowing what the technology is providing is extremely important. Secondly, is fairness, making sure the technology you can think of it almost from a democratic perspective, that it is fairly accessible and then can be used within communities by everyone who needs it. Then you have important principles like accountability. So
Yeah.
you understand if the technology is actually not working as one expected, how did you reach those results, or even the owners of that technology, how do you keep them accountable, and even those that allow the technology to be used, for example, in a health system. And that's why it's so important to have a regulatory framework where that accountability mechanisms
Yeah.
can be in place. And so these are the kind of principles that I would say that are critical to make sure that AI is accessible for all, but also making sure that the technology is designed in a way that doesn't leave anyone behind. And to do that, just one last issue is to make sure that the technology is unbiased. And
Yeah.
the bias issue has been discussed a lot. What does that mean? And basically, if you think, I'll give you an example.
Yeah.
It's a classical example already, but it helps for anyone to understand. So there are a lot of apps out there that use AI to, for example, to try to diagnose if you have a skin lesion, to understand if it's a serious lesion or if not, or if you should go to a doctor. And there was this tool that was developed to taking pictures with your phone to assess those lesions, and it was developed some high income countries where mainly white population,
Yeah.
Caucasian population, and then it was deployed to countries where people have a darker skin. And the tool that seemed to be very effective in its original format, since it was built up on images from those regions and not adapted to the other regions with darker skin, the tool was a flop. And so that's a very clear demonstration how the tool was not designed to be inclusive. It was not designed to be unbiased. And so that's a very concrete example. But then you have nuances. If you think about a technology that's supporting a doctor to choose what is the best chemotherapy to treat a certain cancer, if you do not look into the specifics of the genomic sequencing, for example, of the population that you're serving, or even of the specific patient, you may be actually getting a hypothesis, a suggestion from the AI that is not the best suggestion for that patient in particular, because the information is biased or ill-informed. And so these are very nuanced. I don't want to go too technical, but I
Yeah.
believe that with these examples, it's easy for anyone to understand
Yes.
how we have to be cautious on how we use these technologies. But if we get it right, we can get results like we've never got before, that no
Wow.
human alone will be able to do. And I believe that right now, the future, some people already are talking about a future that healthcare is provided only by machines. I don't know if we'll ever get there. But I know that today and over the next 20 to 30 years, we will be living in a world of symbiosis in where machines and humans can interact to provide better care for all. That is a future that is in our hands to build together.
Actually, I was going to ask you, what are you most excited for about the future and what the future holds, considering the developments in the world of technology and AI? And I think you answered that even before I asked the question. So, if there's something else you want to add to that, I would love to hear. But I think I got my answer before even asking the question. So,
Yeah.
there's some telepathy happening here.
Yeah, well, I mean, as I said, I really want a world where technology, be it AI and others, can be used to help us really transform the way societies are governed. And that we look at healthcare not as something that is organized in a health system, but we look at health for all and health in all policies as a way of life. In which, when we talk about culture, when we talk about physical education, when we talk about the economy, that the principles of well being, of quality of life are at the core of everything we do. And if we do that, we can actually transform our societies to be much more driven towards what makes us human. We've been talking a lot about machines and AI, but at the end of the day, we need to use these technologies to reinforce our human connection. And we've lost that. And, through technology, through social media, through all of these things that seem to make us connected and more connected, it seems sometimes also to make us less connected as humans. And doctors having a screen between themselves and the patients in their office, in the hospital, all of these things are barriers that I hope that in the future we'll be able to overcome, and that we can reinforce the human centeredness and the role of compassion in not only in health but in society at large. And we focused a lot on health. We talk about healthcare, but we typically talk about health. I think it's time that we start looking a bit more on the side of care, and through care we can be more compassionate, more caring, and hopefully that will lead to better mental health and better quality of life for all. And if nobody else, the youth are the ones best positioned to promote those transformations. And so your podcast is more important than ever, Gopal. And so I thank you very much for the invitation.
Well, Ricardo, thank you so much for taking out the time to do this. And honestly, like, it's not just we talked about governments, we talked about people working behind the technology, but citizens like me, people working behind my team working at Yodhya. I think everybody needs to imbibe some of those things that you mentioned: compassion, kindness, and just care, and be responsible citizens. And I think everybody can. That's how we can drive that larger change. Not just at a policy making level, but also at just like an individual level. So thank you for shedding light. Ricardo, we have a quick 5-minute segment in the end, so I'm not going to take much of your time. I'll wrap it up in like 3 minutes. We have a few quick questions. It's called it's sort of a rapid fire, but we're calling it a rapid dialogue. So I have just a very few quick questions that will have, fast answers. And can we dive into it? Three more
Yes, of
minutes.
course. Let's go.
Okay. Awesome. Cool. All right, Ricardo, my first question. Coffee or tea in the morning?
Coffee. Absolutely.
All right. Okay. What book is currently on your nightstand?
I just started reading, revisiting actually, Deep Medicine by Eric Topol.
How nice. Okay. One word that describes your approach to life.
Hmm, that's a hard one. In one word, I,
Okay,
I'd
you
say
can. Okay, you can
purpose.
say more than one.
Yeah, I can
Sorry,
say purpose. Purpose.
purpose. Oh, that's lovely, lovely. What's that one hobby you've always wanted to pick up but never had the time
Oh,
to?
um, playing tennis, I would say, is something I'd love to do, but never. Probably lack of talent more than lack of time, but
Nice. Table tennis or lawn tennis?
lawn tennis. Yeah.
All right. Okay. Digital notes or handwritten notes?
Well, I now use a tool called Remarkable, which is a mix of both. They are
How
handwritten tools
nice.
on a digital format.
How nice. Okay. One moment from your journey that you always seek inspiration from. This could be a little.
Yeah, well, I'd say one moment that I look back at is not actually a moment from myself, but from my parents.
Hmm. Yeah.
How my parents actually, having become refugees, as I told you, going to Canada, starting a new life, really making an effort to, while my mom was working, my dad was studying, and then vice versa, sharing their effort. It gives me, a lot of hope when things look tough, that they were able to overcome such difficult situations. And so that's always a source of inspiration to have that in my parents that passed me on those values.
Oh, nice. Thanks for sharing that with us. What's the one piece of advice that you would like to give out right now to the people listening to this podcast?
Well, it's more of a plea of
Yeah.
it's a fight against the biggest disease of our time, especially
Yeah.
the youth, which is the disease of indifference. Uh,
Yeah.
don't
Mm.
fall into your trap of living alone, believing that your life is isolated. We are all interconnected,
Yeah.
and try to connect with other humans. Try to do things that have impact on other humans. And if you do that, the most amazing things will happen to you, coming from corners you're completely unexpected. And so put yourself out there, put yourself to the service of the world, and the world will pay back many times.
Wow, that is some brilliant advice. And talking about advice, Ricardo, what's the best advice that you have ever received?
Hmm. Don't dwell too much on the past. Keep focused on the future. And
Nice.
yeah, I think that's extremely important. Life isn't made out of regrets. It's made of the only. I think it was Peter Drucker who said that. Uh, how was it that the future, the best way to predict the future is
Hmm.
to create it, and that's something that is in our hands to do.
Yeah. Awesome. Thank you so much, Ricardo, for doing this today. I had such a beautiful time talking to you. I had so much to learn, and I'm sure so will the audience when they hear this. So, thank you so much for taking out the time. And I know you have a packed schedule, so I'm not going to hold you for too long. And just thank you. Thank you for everything.
No, thank you, and I wish you all the best, and I hope that the youth can use the power of technology to help us move forward with the sustainable development goals, but also ensuring
Yes.
health for all. Thank you so much, and congratulations once again for your podcast.
Thank you. Thank you so much, Ricardo. Thank you. And for everybody watching, if you do feel inspired after this episode and you want to drive some change, well, hit the link in the bio, read up more about youth and what we're up to over here, and perhaps even become a member of our community. And of course, don't forget to like, share, subscribe, drop a comment, tell us what you thought about this particular episode. I'm going to see you in the next one.